Hi, everybody. It says I'm live. Good stuff. We'll give everybody a couple minutes here. I'm on today to do a live Q&A with you guys to answer any dental questions, any dental hygiene questions, any basic questions you have. I am here to help you. A quick little introduction of myself if you're just kind of joining us and maybe new to my channel. I've been a dental professional for 17 years. I am currently a restorative dental hygienist with my own mobile dental hygiene business. So here in Ontario, we can have our own dental hygiene practices. I do have one where I go mobile into patients' homes. I've been tutoring dental hygiene and dental assisting students for about 17 years, and I also help consulting as well. So I kind of help dental hygienists through anything they need help with, including opening up their own dental hygiene practice, teeth whitening business. If you're audited, I kind of walk you guys through that, help you. I'll leave my website down for you guys down below. You can definitely check it out and see all of the courses, all of the help consulting that I do offer. Okay, you guys. Now, but does anybody have any questions? This can be any dental related questions, whether you are just a regular person, you have tooth questions, you have dental questions, or if you're a student, you have questions about any courses, you want to start your own teeth whitening business, whatever questions you have, I am here to help you guys. I do try to answer comments, so thank you guys so much for commenting on my YouTube videos. I do try to get to those comments. I can't always get to all of them, which is why I do these live Q&As often. I do have an email as well on my main page. Definitely reach out to me if you need more help, okay? Because as you can imagine, things can get pretty busy. So Amanda, hello, so nice to see you. And I will also say, you guys, if you don't mind, I'm going to say it. Please click like to this video. Believe it or not, it really does help me and my channel, and it allows me to offer more free content, more videos. Definitely subscribe to my channel because I do upload videos. Lately, it's been almost every day because I've been working from home. But it's at least once a week, if not more. If there's a certain video you want to see, I am here to upload it for you. So just let me know. I do have some questions that I've been keeping note of, some popular questions that people ask me over email or over Messenger. Lately, it's about the teeth whitening business. So I'm going to talk about that, but please feel free to message in our chat box and I will absolutely answer you. Okay. I did say that I was coming on live at 1:30. I just realized it's 1:28, so people might not be here yet, but you will be able to watch this replay anyway. So teeth whitening businesses. So if you guys look on my website, I do kind of talk more about that. I'll leave the link down below for those of you who are inquiring about your own teeth whitening business. You can have your own teeth whitening business with proper certification. If this is something you have thought of, if you want to be your own boss, make your own hours, and whitening teeth sounds exciting to you, I can help you guys start your own business. I do offer a full online training program with a certificate at the end. So, and I do have a Facebook group actually with that as well. Let me kind of look on my Facebook group right now. If you guys wanted more information, it's the Whitening Pro Academy. You can definitely join the Facebook group to kind of read, learn more. I have a lot of videos on the Facebook group as well, where I just kind of talk about the course. I talk about what it's like having your own teeth whitening business. I talk about a lot of things because, of course, you're going to have a lot of questions. So that is what I wanted to mention. That was one of the questions actually a few people had. Another question I get a lot is basically, how many hours do I recommend studying for the board exam? So we're talking about the board exam. If you're a dental hygiene student or a dental assisting student, how many hours do I suggest studying for the board exam? So I do actually have several videos about this topic on YouTube as well. I suggest 6 hours at the most every single day to study for the board exam, and 2 hours minimum. So if you have a full-time job, if you have kids, you have a family, you can't just find 6 hours a day to study. So then I want you to study for 2 hours at least every day, because that's constantly keeping your brain going, activated, if you will. If you take 2 weeks off, you're probably worried that you're going to forget what you had studied before. But if you're consistently studying a little bit every day, You can take a day off, absolutely. Then that will really help you guys prep for the board exam, okay? So I get that question actually probably a lot. And then I still have students tell me that they're like literally studying like 8 hours every day. Don't do it. There is such a thing as studying too much. You can just kind of overload your brain where anything you study, you're no longer learning anything because you just have so much in your head. You are annoyed at yourself for not learning as much as you could, or you feel you're not retaining as much information as you could. So don't study too much, okay? That's the moral of the story here is don't study too much and don't study not enough either. I do offer a couple different board exam prep courses. I offer a full board exam prep course, a VIP package where it has everything you need to know to study for the exam and pass, but I also offer the express package as well. The express is meant for if you're taking the board exam tomorrow or next week or next month. You have very limited time to study, but you want to take some extra quizzes, mock exams, learn about the main topics like pharmacology, oral pathology, special needs, medical emergencies. That is the express course. You have limited access, but you learn kind of what you need to in a quick period of time. So definitely look at my main website and you will find that at dentalelle.com. Okay. So another question, you guys, was actually, I think, a patient question, or like a client question, potential patient. I got a few questions because I recently uploaded a video on the differences between xylitol and fluoride, and I had somebody, or actually a couple people, sort of asking me to explain that a little bit more and what products I recommend. So xylitol is basically something in toothpaste, mouthwashes that helps to prevent bacteria in the mouth. If there's no bacteria, you can't get a cavity. It's that simple. But more importantly, it helps to keep the mouth at a more neutral pH balance. If your mouth is highly acidic because you're drinking a lot of coffee, tea, sugar, then it's much easier to get a cavity than if your mouth was a more neutral pH. So xylitol helps to maintain that. And then I talked a lot about sodium fluoride. Why is fluoride needed and xylitol needed? So fluoride helps to actually remineralize and helps to treat the teeth, helps to make the teeth a bit stronger for those areas that might have a cavity or a potential cavity. So I suggest both. I suggest a toothpaste and mouthwash with xylitol and sodium fluoride in there. They can be hard to find, and you not everybody needs them. If you never get a cavity, you never have any tooth issues, you don't have cold sensitive teeth, you can literally um, pretty much use whatever toothpaste you want and you don't even necessarily need a mouthwash. But if you get a lot of cavities every dental visit, you're like, oh my God, I have a cavity, I have another cavity. If you get cavities at every visit, you need to do something else and it's time to switch to a xylitol and a sodium fluoride toothpaste and mouthwash as well. Now, I'm currently researching different products and different price points for my clients, but I like the company Oral Science. I'm going to make a note of that for you guys here in the chat box. I like the company Oral Science. Their toothpastes and their mouthwashes contain fluoride and xylitol. There are a couple though that don't contain fluoride and just contain xylitol. So have a look, but you have different options for both kids and adults. I like their mouthwash called Opti Rinse. It comes in mint, it comes in grape, so they have different ones, but that also includes xylitol and fluoride. So you're kind of doing whatever you can for your mouth. The more you do at home, the cheaper it's going to be when you go to the dental office. You won't have to have your teeth cleaned as often. You won't be visiting the dentist like every 6 months because you have two cavities every single time. So basically, the more you do at home, the better and the cheaper for you, whether you have insurance or not. The more you can do at home, the better. Okay, does that make sense? RJ, hello. If there's any questions, you guys, don't hesitate to comment in the chat box. Okay, I'm just kind of reading off questions for now that people have asked me before, and I didn't necessarily have a chance to respond to. In fact, can I look at my YouTube comments right now and kind of respond to some comments like from previous videos? Because you guys, it's hard for me to do that. I don't mean to not respond. It's just hard because I get so many amazing comments. So please do not hesitate to comment. Just might take me a little while to answer. My YouTube isn't loading, probably just because I'm doing a live stream. That's my guess. But yeah, you guys, if you have any questions, definitely let me know. I do have a Facebook group for students as well, if that's something you are interested in. Can I grab that link for you guys? Let's see here. I have a Facebook group for students. So that way, if you have any questions about my courses, any of that, it's titled Dentalelle Tutoring. Ah, yes, RJ, the dental assisting board exam. I know. Definitely look through my channel. Do a search for like dental assisting board exam. Even do a search for board exam. I have tons of study tips. I have free mock exams, everything for you to really help you. Basically, it depends on when you're taking the board exam. So, when are you taking your board exam? The tips that I automatically always recommend is do as many mock exam packages and quizzes as you can, because you might think you understand the material, and then when you go to do a mock quiz, you know none of the answers, because it's not just as simple as reading the textbook, questions, answers. You have to really be able to apply those critical thinking type questions. So, absolutely do those mock exam questions, quizzes, all of that. Even before you do those quizzes and things, I would study the topic, because a lot of students think, okay, I'll just take a bunch of mock exam questions, quizzes. I'll answer them all, I'll memorize the answers, and then I'll be fine. No, if you kind of take a mock exam practice test and you haven't studied the topic first, say it's oral pathology, you're not going to know the questions. You're going to get more frustrated, and then you're just basically memorizing the answers. So study the material first, and then take the mock exam quiz afterwards. Whatever kind of works for you, but that's what I find is the best. RJ, I don't know if you're inside my VIP package, the Board Exam Prep Academy, but that's what I tell my students. I tell my students to really study the module first, and then take the mock exam practice quizzes under the module, and then listen to our class recording on that topic. And you're kind of like studying that topic in different ways. So you're reading the PowerPoint, you're listening to the teaching video, me teaching you, but then you're also taking the mock exam practice tests. So you're kind of learning everything you have to, but in a more exciting way. So you're not just reading a textbook, reading notes, you're actually learning things, again, in an exciting way. Does that make sense? RJ, but let me know if any questions. You're taking the board exam in June, which is great. I love to hear that. You have enough time to study. Definitely study every day. I know I have videos about this on YouTube. Like basically, if you do a search for study tips, you'll find tons of them where I talk about how many hours per day. I talk about it's okay to take a break, like it's okay to take a day off, but then the next day study 6 hours, not 2 hours. There is a method, like there actually is a method for proper studying to pass the board exam. I've seen it. I've seen and I've heard from students where they passed the first time and they didn't. I kind of asked them, well, what were your study habits like, so I can help other students. So it's good to get into a plan. Paul, good question. Did a patient ever bite my fingers? Not really that hard. The only time I'd say that patients bite or did bite my fingers would be if I'm taking x-rays. So if I'm trying to take an x-ray on a child and I'm trying to put the x-ray in there, they might think it's their turn to bite down, because they know eventually you have to bite down on the x-ray to keep it in place. They might bite my finger. But I've thankfully like never had. That's a really good question, and a popular one too. I've never had like a patient like purposely bite my finger to like ouch, and think it's funny. Kids are funny, like they do say they're gonna bite my fingers all the time, but they never actually do. So I bet when I go to work tomorrow, you guys, I'm gonna have a patient bite my finger. I wouldn't be surprised. You know what, RJ? I would start studying right away. I tell my students to literally study a year before you take the board exam so you can take your time. But 6 months is perfect. Start studying now. Honestly, you will thank me later. If you start studying a couple months before, you'll feel too rushed and you won't study properly. So now is a good time to start studying. Absolutely. If you go to my website, I do have some free mock exams on the main page. If you like scroll down a little bit. So definitely look at that. It can't hurt to take some mock exams to kind of see where you're at. So definitely do that, right? It can't hurt. That's a good question. But yeah, I basically tell people to study for the board exam as soon as you possibly can. Even if it's a year before, why not? Like study a little bit every weekend. And then when you get to be 6 months, then study every day for sure. Absolutely. I find when I talk to students, they typically tell me they started studying 3 months before the board exam, but then everybody says, I wish I started sooner because you feel like you need more time. But 6 months is great. So now is a good time to start studying for sure. I know when I took my dental assisting board exam, I probably studied 6 months before, probably because my course for dental assisting was like 11 months back then. So, you don't really know what to study for right away. So you kind of do it like 6 months before. I went to a school in Toronto too. We might have went to the same school. Keele and Finch. It's funny. It's been a while since I've lived in Toronto, but we might have went to the same school. So how I got clients? How did I get clients? Actually, I got clients online. So I would advertise on Kijiji at the time. I would advertise on Kijiji. I'm offering very cheap dental hygiene care, teeth cleanings. That's how I got all of my clients. These days, it's even easier, not easier, but it's easier to market, to advertise. Now you can go onto Facebook. So, like, you should definitely join Facebook groups like Toronto Moms, Toronto whatever, even Toronto Buy and Sell. I wonder if you're allowed to advertise there. That's what you should do. In fact, I have a YouTube video on how to find clients for your school. So do a search for that. Like do a search for how to find patients for school or how to find clients for your clinical, something like that. Do a search and you will find it. RJ, if you go to my main website at dentalelle.com, scroll down a little bit and you'll see lots of free stuff. Mohammed, hello. You said MBBS. What is that? MBBS? I feel like I should know that. Oh, it's your second term in hygiene school, Amanda. Well, that's exciting. That's exciting. I remember hygiene school. Again, I have lots of videos on how my program went, how hygiene school went, how clinicals went. Take a look if you want to laugh because they're kind of funny videos. I'm glad I'm not in school anymore. I swear I still have nightmares. But of course, you guys, it's worth it. So hang in there. It's not forever. You'll be a dental hygienist or a dental assistant soon. It's a great profession to be in. Trust me. I love it. Hence why I have my own business. RJ, you know what? With the pandemic, I truly don't know. They used to just have a bunch of people meet in a room for the board exam and you would do it online. When I took the board exam, it was on paper. So that's how old I am. But now it's all online. A portion when the pandemic first started, they were actually doing it. I heard they were doing it online, like, and you could do it from home, which is kind of crazy. I don't see that happening. So you probably have to meet somewhere. Yes, there are other people, and you do it online. Ask your instructors because they can tell you specific to your area what the board exam's like and kind of what to expect. Yes, I am in Canada. I am near Toronto, Ontario, Canada, if that makes it easy. And you know what? It's normal. It's normal to not like your program. It's normal to have a hard time. It's normal to have nightmares. Nobody ever says they love their college program. Nobody. But it's worth it, I promise. So hang in there. That's a good question. Do I prefer submitting my portfolio or writing the exam? I was actually audited last year and I submitted my portfolio only because I don't think it's right. We have to pay for the exam. So I thought, well, if I submit my portfolio, it's free. So there you go. I'm just going to submit my portfolio. But submitting your portfolio is one more thing that our Dental Hygiene Association looks at manually. So it's just kind of, you have a greater chance of getting audited, in my opinion, if you submit the portfolio. Because what if they find something wrong in your portfolio or they don't agree with something? Whereas if you take the exam, you either passed it or you didn't, you know? But you also have to submit your practice profile. So that's where a lot of hygienists are getting calls for clarification. After the assessor assesses your practice profile, they might be confused about something. They might be not sure like what you had written for sterilization. They're going to call you to clarify or even do an on-site visit at your office. I offer help with that too. So if you need help with your practice profile, if you need help with your portfolio or taking the exam, the quality assurance exam, I have courses for all of that. Marie, let me know if you have any questions and I can send you links to that. Or, of course, you can go to the website at dentalelle.com. You guys, I do a little bit of everything, I do. So, Maria, I hope that answered your question. Let me know. If I was to do it again, I do the exam because, I tutor for the exam, so I I can pass it, obviously. But I just don't like that we have to pay for it. We have to pay enough for our silly Dental Hygiene Association fees. Like, oh my God, we have to pay so much. Oh, you have pre-clinic. Oh my God. You know what? I just uploaded a video on YouTube about corona polishing, not air polishing, but air polishing is exciting. So good luck in pre-clinic. Actually, I just did a lecture on this for my students in the Board Exam Prep Academy on air polishing. So basically, it's fun, but it's messy, okay? It's not like corona polishing with the slow speed handpiece. The air polisher, you like have to hold away a little bit and you have to suction at the same time because there's all that stuff, and then you air polish along. But just be careful, you don't want to polish the gums. You have to angle it a certain way so they can help you in pre-clinic for sure. I love the air polisher, but I don't use it because it's too messy. It's messy. You will find that. Oh my God, your poor patient is covered. Patients don't want to be covered. I'm sorry, but they don't, like in stuff, right? They don't want to be covered. But good luck, though. I think it's going to be a lot of fun for you to learn. You know what? I'm very lucky, you guys. I do not have neck or back pain. Admittedly, I'm 36, okay? So I do get a stiff back if I'm sitting at the computer for too long or if I'm working all day. Yes, I'm going to come home and kind of feel like I have to stretch a little bit, but I'm not in chronic pain. I know a lot of hygienists, you guys, who are in chronic pain, but I suggest getting loupes. Loupes are those like magnifier eyeglasses. I've been using those since probably my second year in practice, and they help because they help you sit up straight. The teeth are larger, things are magnified, so it can't hurt, right? You tend to slouch or like bend over when you can't see. But if you have magnifiers, it does the hard work for you. I have a YouTube video on that too, where my new loupes are from Amazon. They were $80. Fantastic. The first loupes I purchased were $2,000, probably even $2,300. And they work just as well. I'm not even joking. Yes, Amanda, good. I'm so happy. Aren't they amazing? They have the magnifiers, they have a light. You can adjust them. What's not to like? And $80 is a steal. I'm telling you, you guys, they're amazing. And while I'm talking, you guys, I'm going to look up the link from Amazon right now. If you guys do a search on my YouTube video for loupes, you will find a video where I talked about it. Guys, they might be on sale right now. Hold on. And unfortunately, with Amazon, I don't know if you guys have noticed this, but the link keeps on changing. Like, I have a link for you guys to purchase the loupes, and then people tell me, like, Andrea, the link doesn't work anymore. And I'm like, it just worked yesterday. So let me just try to find it, you guys. I can't find it right now because um, the loops that I bought are no longer active, like they're sold out. So I'm just trying to find the equivalent. Okay, good. I think I actually did. See, and they range on price, you guys, with Amazon too. Like I see $100, I see $200. Why? Get these ones. Now they have 2.5. Oh, these are nice actually. These are nicer than mine. Um, sorry guys, I'll show you in a second. I'll copy the link. Can you guys see the chat box? When I post the link for you here, because I can't share my screen, I don't think, can I? I posted the link, you guys. I'll do it again so you can see it. These are the 2.5 magnification of loops. You might need 3.5 though. I have 2.5, that works for me, but you might need 3.5 magnification, like if you have trouble seeing close up. I wear glasses for distance, so like far away, not close up. So 2.5 works for me, but you have options. Yes, Amanda, most people get the 3.5. I'll leave you guys the links for the 3.5 too, okay? So the first ones are 2.5. And you guys, with Amazon, if you don't like it, take it back, right? Amazon's amazing. So, ooh, the 3.5 are cheaper. Amanda, I don't know if you got the cheaper ones, but these ones are only 67, of course. Here, let me copy that link and then I will get back to the chat box, you guys. Sorry, because I see you guys are asking more questions. Okay, 3.5 loops. There, guys, I am posting in the chat box the direct link. Get loops. That will help your neck, your back, I promise. If you don't like them, you guys take them back. Amazon's awesome. But loops are amazing. Oh, RJ, how long did it take to get your results back after taking the board exam? Back in my day, it literally took, I want to say 8 weeks or 10 weeks. Now it could be 2 weeks or it could be 10 weeks. So it varies. Most students, most times, I feel like it's 2 or 3 weeks. So it's not like it's not fast, but you don't have to wait too long. But then sometimes, you guys, it's 8 weeks, it could be 10 weeks. So to get the results back, it takes a while. Let's see here. Yes. Marie, are you audited? Like, do you have to take the exam or submit the portfolio before January 31st? Or are you audited for this year? So next January 31st. Let me know, because I do have a lot of options for you if I can help. And that's a common, that's a common fear. People don't want to take the exam because they're afraid they're going to fail. Then do the portfolio, because then you don't have to worry about failing. So you have options. Oh, okay, good. Maria, so like, let me know. Think about it. Think about what you want to do. I do offer a course for the quality assurance exam to actually study. So it's a full study course. Or I do also offer something called an online portfolio workshop, where it's a full course on how to write your portfolio. So I do that too, all on the website. So definitely take a peek. Okay, sorry. I'm just checking the questions. I apologize. They came fast. So if I'm missing somebody's question, just ask again. Oh, perfect. Selena just said that she started her first dental job in a perio office. Very exciting. That will keep you on your toes. It's hard work, but that's great. That's fantastic. And I put the links for the loops already. Perfect. Yes, start practicing in pre-clinic. That's a great idea. And it's not much of a learning curve, like, because you see better. A lot of students though, they will get a headache the first couple days, just because it's something new. It's kind of like if you were to wear if you were to wear glasses for the first time, you're going to get a head, like your head's gonna hurt, like tension, because you're focusing with something. I didn't have any problems when I first started my loops, but you just never know. So that's normal if you do experience that. And sorry, how much do I charge for my tutoring? So I have different programs. I have a full tutoring course. I can get the link for you right now. Sorry, I actually thought I had my website up there. I do have a full tutoring course, which is around $380. You said you're a dental assisting student. So if you're curious to read more about that, I'll leave the link for you down below. And I do offer a payment plan also if that helps, because I do understand money is tight, but I can't stress enough. It's a good investment. It's a great investment. If I can help you pass the board exam so you don't have to take it again, you're actually saving money, because every time you take the board exam, you have to pay. Not to mention it's stressful, right? So I'm leaving the link in the chat box for you, but definitely check out the main page. So I have a board exam prep course for dental assisting students and a board exam prep course for dental hygiene students. I can help you pass. I have a 99.7 success rate helping students pass. My program is good, if I can say that, and you get full support by me, so it can't hurt. I want you to pass the first time so you don't have to worry about it. And you know, it's hard to know what to study, because you don't just want to open up your textbook and just study a chapter here and then study a chapter there. No, inside my prep courses, you have modules, you have all of that, you guys. So I tell you what to study and when to study. Plus, there's teaching videos such as this, where I teach you a topic. Yes, exactly. It is international. So I help dental assisting students pass the board exam in Canada, the States. I help you. Yes. So for the States as well. Yes. Great question. And that's the link that I had sent you. Yes, so I have a tutoring course for those in Canada and those in the States as well. It is the same link to sign up, but then when you log in, you'll see like a separate one for the States and then a separate one for Canada, if that makes sense. So, and I can help you. The main differences are the tooth numbers. So you might hear me say the tooth number 17. Well, if you're in the States, you're going to be like, what the heck is that? But I offer you guys a chart to see like the different tooth numbers for the States numbering system and then for Canada too. So don't worry, that's a very common question. I tutor for everybody. Actually, Amanda, you can take the board exam while you're still in school, but you have to pass certain clinical requirements. I took the board exam before I had finished school. So I took the board exam 2 months before I graduated, but that was because I had enough clients and I felt confident to take the board exam. Plus, I had a job waiting for me when I got out. So I kind of wanted to take it sooner rather than later. Or you can wait until you're done school and then like study all of that and then take the board exam when you feel ready, because they typically have the board exam several times a year. But I do suggest studying at least 6 months before the board exam, if not a year before. SC, sorry, I'm just reading your question. How come we do so much during dental hygiene school, but practicing in private? Aha. I know. So in dental hygiene school, you literally, and same with dental assisting, you go through everything step by step. And then once you get into private practice, it's very quick. You should still be assessing the teeth. You should be doing the probing, all of that, but it just might not be that intricate, intricate. Like you still do it, but it's not as crazy. I like that though, because in private practice, we don't have time to spend 4 hours on every patient. But you should still be doing the assessment and everything. Like I have my own mobile dental hygiene practice, and I have a new patient full exam for all my new patients because I want to do a full assessment. So I take the time. For new patient exams, they're typically an hour and a half long because I chart the whole mouth, I do the probing, I look tooth by tooth to see what they need. But yeah, I know it's different, isn't it? From private practice to school. And you guys, I'm going to say it. If you haven't yet, I'm going to type it in my chat box too. Make sure to subscribe to my channel because that does really, really help me, believe it or not. And click like on the videos. That does help me. That helps me to be able to offer more free content. So I really appreciate it, you guys. I do. And I do upload videos often. So always check back. Does anybody else have any questions, by the way? I was going to do a half an hour question and answer, but I can do a little bit more because half an hour is up already. Time goes by way too fast. So I can do another 10 minutes if you guys like. I am happy to do it. SC, good question. When I find in private practice, I agree, clients do kind of get mad, to be honest, if you don't clean the teeth the same day. I'm just being honest. When I book a new patient exam, I do the assessment and the cleaning the same day. I might not be able to finish the cleaning if there's a lot of like plaque and calculus, but I can at least get them started. So that's what I suggest doing. Quite often in private practice, when I used to work in a dental office, they would see the dentist first for the new patient exam. They would spend like an hour and a half like with them going through everything, and then they would see me, the hygienist, for a cleaning, and that seemed to be okay with them. Like they didn't mind spending 2 hours there. So it's funny how that works, eh? Funny how that works sometimes. Yes, I am still reviewing practice profiles and portfolios. So if you are asking about that, if you're a dental hygienist who is being audited like January 31st, you have to submit that, you guys, fast. Yes, I am still reviewing practice profiles and portfolios, probably right up until January 31st. But keep in mind, you guys, I need time to read through it, make suggestions if you need to make changes. So the sooner you get it to me, the better. Okay. Please allow 24 hours for me to get it back to you. Does anybody have any other questions? Oh, you just started seeing clients in school. Good luck. Good luck. Yes, in school, you're going to be seeing clients for like 6 appointments initially. I know, I remember. There's a lot of assessment, there's a lot of marking. It's a lot that you really shouldn't have to do, but you have to do it. Trust me, I remember. I wish we had a dental hygiene school where I lived. I would be happy to be somebody's patient because I know how stressful it is. Trust me, I know. Good luck though. Definitely check out my channel. I have lots of tips and stuff for you on some videos. Yeah, that's definitely the scariest thing, isn't it? Is like seeing real people, real clients. I will never forget my first patient. I will never ever forget. I was so nervous. I barely like touched her teeth. And I'm like, okay, I'm done. And my teacher was like, no, you're not. There's still plaque. And I'm like, really? I was scared. I definitely failed that client. Oh, awesome. Thank you so much, SC, for sharing my channel. That's very exciting. Thank you. And you know what, you guys, not to toot my own horn, but I know I can help. So please, yes, please share my channel. I'm here to help students. I'm here to make this less stressful. I wish there was somebody like me when I was a student. That would have really helped me. I had nobody. There was no such thing as a tutoring program. Like there just wasn't. So I'm here to help you. So please let me know if you need help anytime. I do upload videos a lot, so definitely make sure to subscribe. Sorry, my dog was just choking there on a bone. Think she's good now. Paul, really? Paul just said that some dentists don't wear any protection on their hands. They should definitely always be wearing gloves. That's gross. They should wear gloves. Like we've had to wear gloves since like 1985. Before then, we didn't. How crazy does that sound? Ugh, I can't imagine. So yeah, Paul, I'm sorry. I can't answer that for you. If you see that again, I would be like, here's some gloves. Put them on. That is so weird. Mm. Ah, yes, SC, I know. I totally understand where some students can get away with murder. I know, and then others can't. Um, Marie, unfortunately, it does have to be by the Smile portal. I do offer help for that too, though. If you go to my YouTube channel and type in Smile portal, I show you guys how to do that. So don't you worry, I can help you. And inside the online portfolio workshop, which I could give you the link for that if you like. Because I feel like you might want to do the portfolio. You might not want to take the exam because you don't want to have to worry about failing. I have a video inside the portfolio workshop where I show you how to upload everything so you don't have to worry. Like I can actually help you. So here, I'll leave you the link. I just got it for you. There you go. But yeah, I know it's stressful. I'm old school too. Like I don't like things to be like things changing. And I feel with our dental hygiene association, things are literally changing like every year and it's driving me crazy. So, but it's my job to learn the updates, to learn the changes, and to help you guys. Okay. So don't worry, I can help you. But I do have a video inside my YouTube channel as well. But if you need like step by step, then definitely inside the online portfolio workshop. I help you with all of that. My pleasure. A full mouth probe, I do it at least every year, if not more. If I have a patient who has severe perio, I want to be checking every 6 months. But you have to do it once a year, okay? Because you need to really evaluate how things are going. In school, they're going to tell you every year. In school, though, they might want you to do it at the beginning of the appointment and the end of the appointment. So that might not be, well, that's not going to be 6 months later. It's probably going to be a month or 2 or 3 later. So you might be doing that. Oh, sorry. Full mouth series. Oh, um, in a dental office, we usually did a full mouth series every 5 years. But honestly, it's not necessary. Like I do feel like it's good to have for new patient exams so you can see every tooth everywhere how it's looking. So then if anything goes wrong, if there's any changes, you have something to compare it to. But you really don't need one every 5 years because nothing's going to change. Just sort of take specific ones. But yes, in school, I know you learn how to do that, and that's good because you will be taking them often. It depends on who you work for. Um, no. So if you're a dental hygiene student or a dental assisting student, you have to take the board exam in order to become a licensed dental professional. What me and Marie were talking about is if you're a dental hygienist already, so you are a dental professional and you have been audited. Depending on where you live, you get audited once every 6 years. And then if you're audited, you can either take what's called the quality assurance exam or submit your portfolio. So I won't go into that too much because I think a lot of you are students. I don't want to scare you, but yeah, but it depends on where you live. And you guys, my apologies. Can I let my dog out? This is live. I'm sorry. I'm just actually, no, I'm not. She can wait. Hold on, princess. You just rest. But actually, you guys, or I'm leaving soon anyway, because I did say another 10 minutes. My bad. I do have to go teach. So that's just why I have to leave soon. I'm sorry. But I'll definitely do more question and answer lives because I'm happy to see that people like it. I know when I was in school, I had to do a full mouth series on every client, every new patient. It was ridiculous. Some children, adults, seniors, I hated it. Because in school, you're like new, you're still learning, you're not comfortable. I promise you, you get comfortable taking x rays. You'll be so comfortable, you will love x rays. I promise. I promise you guys. Does anybody have any other questions before we go? Because, yeah, I do have to teach, and you can see my puppy princess. She wants to go out. But yes, you guys, please like this video. That would be so awesome. And definitely check out my YouTube channel. I have tons of videos. Do a search for whatever you're looking for. I promise you, you'll find it. I have everything. Amanda, you're so welcome. Thank you guys for hopping on. I really appreciate it. I know it was short notice. I just don't always know when I can come on because it depends if I have patience. How many hours do I work per week? You know what? That's hard to answer. If I'm seeing patients, I typically see patients from 10 a.m. till 2 p.m. 5 days a week. Sometimes it's 7 days a week. Sometimes it's 2 days a week. Princess, hold on. Come here. Sorry, guys. But then I teach and I tutor in the evenings. So technically I'm working 24/7. But I do take time off though too, I promise. Oh, Amanda, thank you. Thank you. That is so nice. I love what I do. So, and I remember being a student and not having the support, not having very kind teachers, not having anybody to go to for help. So, I really want to be that for dental hygiene and dental assisting students out there and for dental professionals. I'm here to help because I know it can be stressful both ways, students and dental professionals. Well, you guys, thank you. I am sorry that I have to go teach. I apologize. Some more board exam preparation. But if you guys have any questions, though, ever, just feel free to comment on the YouTube videos. I'm going to leave you guys my email as well in case you want to reach out to me. I typed it in the chat box. Definitely, sorry, Princess, hold on. Definitely check out the main website and you'll see courses, all kinds of things there for you. Okay, you guys? I will be coming on again soon for a live question and answer. I need to do this more often. So thank you guys very much. Have a great day and I'll talk to you guys soon. And if you are in my board exam prep academy, we meet like this all the time. So you can have my full support. Even if you are a student still in school, sign up for the board exam prep academy because you have full access for 2 years and I can help you while you're in school. Oh, okay, guys, thank you so much. Click like, that would be so awesome. And make sure to click subscribe. Thank you, guys. Bye for now.